I bet you will not be able to guess what this thing is used for. Leave them down in the comments section below. Hey friends, welcome back. It's Dr. Chan here. In this episode, I am going to talk about a common problem that afflicts men that is very painful and sometimes very hard to treat: prostatitis. So prostatitis is an infection or inflammation of the prostate that causes pain and discomfort in that area between the anus and the scrotum. A lot of times men say it feels like they're sitting on this giant golf ball. That's also very painful. There's different types of prostatitis. There's bacterial prostatitis, which is caused by, a lot of times, by E. coli. And normally this is treated with 4 to 6 weeks of antibiotics, something like Bactrim or Cipro. There's also chronic bacterial prostatitis, which is a little bit more embedded and may require an even longer treatment course of 8 to 16 weeks of these antibiotics. The penetration of certain antibiotics in the prostate is sometimes not great, which is why it takes such a long course of antibiotics for it to completely eradicate it. There's also non-bacterial prostatitis. This is where on the urine cultures and in all the urine tests, your urologist can't seem to actually find a bacteria or grow out a bacteria. Yet, there's still a lot of pain being caused. Even though there's no bacteria, urologists will a lot of times try to treat it with a course of antibiotics in the hopes that it will eradicate it, or that the thought being that perhaps the urine cultures just are not sensitive enough to pick up the bacteria. Now, these days, there's actually much more sensitive tests for urine than just the traditional urine cultures. There's these next generation sequencing tests that can use PCR to amplify very minute pieces and fragments of bacterial DNA. So it's so much more sensitive than the urine cultures are at picking up stuff. But a lot of times, even on these tests, men just do not have any bacteria that are found. So I recently had a chance to sit down and meet with Dr. David Wise, who invented the Wise-Anderson protocol for treating these cases of prostate pain that's kind of lumped in with non-bacterial prostatitis. This is his book here, Headache in the Pelvis. It's been in print since about 2000, but it's a very good book. Dr. David Wise is a psychologist who worked with Dr. Rodney Anderson, who was a urologist at Stanford for almost a decade. Now, his approach to this is a little bit different. It's a different paradigm in terms of thinking about prostate pain and the causes of prostate pain. Instead of trying to find an infectious or inflammatory cause for the prostate pain, the thought is that the prostate pain is caused more by this muscular tightness that develops in the pelvic muscles. Now I want you to think back to maybe the last time that you had a muscle cramp, like a Charlie horse when you went running, or you slept funny and developed like a crick in your neck. I had one of these recently. These trigger points kind of develop in the muscle, and they're very painful. Usually whenever something like that happens, people kind of take a break. Maybe they don't go running, or maybe they try to kind of work the kinks out. And so the same process kind of happens in the pelvis. There's this certain personality of people that tend to kind of develop these issues. People who would be considered perfectionistic or sort of obsessive or sort of high anxiety. And they carry that anxiety in the muscles of their pelvis. But unlike say a crick in your neck, it's a little bit harder to actively work out some of this tightness in the pelvis that causes this prostate pain. And then furthermore, people have been probably going around with these issues for years and years at a time. So this device that I showed you earlier at the beginning of the video, this is a way to kind of release some of the trigger points in your pelvis at home by yourself. It does go up your rectum, as you would kind of imagine, to kind of access these points. And it has this sensor on it that tells you how much pressure you're applying when you're using it. Now the treatment, the Wise-Anderson protocol, it's effective, but it's neither simple nor quick. Usually on average, people have to commit about 2 hours per day for several months to a year before they get complete resolution of their symptoms. But if you're watching this video, you're probably a sufferer of prostatitis and know kind of the misery that comes along with this condition. The time commitment and sort of the discomfort of doing these exercises and releasing the muscle tenderness may be worth it. Anyways, so I just want you to check out, if you haven't had a chance and have never heard of the Wise-Anderson protocol, I highly recommend you take a look at this book and read through it. They also do an in-person seminar in Sonoma County once every 6 weeks or so. But this is primarily geared towards men who, if you've seen multiple urologists for your condition and everyone has basically told you that they cannot find a identifiable cause for your prostatitis, nor do they kind of know why you're having all this pain, then I think this is a reasonable alternative to kind of explore. If you have any questions, please leave them down in the comment section below. All right, thanks and have a great day, okay?